Moving on now, and well, flipping the food pyramid around. The Trump administration issues new dietary guidelines that encourage people to eat more protein, notably through red meat and more fats. They also scale back on breads and pastas. Health Secretary Robert F. Kennedy previously wrote a book about the damage the meat industry does to the environment and said, but he says this new pyramid will make America healthy again. His new guidelines are being criticised as potentially more political than scientific, though nutritionists have welcomed advice to cut processed foods. Well, to get more insight on it, we can speak now to a nutritionist based here in Paris. Charlotte DEBEUGNY, thanks so much for your time. Can I start simply by asking you, what do you make of this new pyramid?
Interesting, isn't it? As you said, they flipped it around. So there's still some very good advice in there. You've already mentioned unprocessed foods. They are asking people to eat more fruit and vegetables in all its forms, which is great. And they're also asking people to restrict their consumption of added sugar. So it's all really sensible advice for general health, for public health. The more controversial elements, again, which you've already mentioned, are the focus on animal protein and the advice on full-fat dairy. So we've been used to hearing about eating low-fat dairy, and also the recommendation to reduce consumption of carbohydrates, even whole grains, for certain people who might suffer with certain chronic diseases.
As a nutritionist, I mean, do you see any justification for any of these changes? I mean, ultimately, is red meat good or bad for us?
The studies are mainly observational, so it's quite hard to pinpoint exactly if red meat per se is the issue for our health. What we do know is that the studies indicate that a higher consumption of red meat is linked with an increased risk of cardiovascular disease. But again, we're not quite sure why. It could be the cooking method, it could be the iron contact, it could be the quality of the meat. There's a definite link with processed meat and an increased risk to our health. So there's that element for red meat, and that's why the general recommendations in other countries are to sort of limit or moderate red meat to around sort of 500 grams a day. So that would be sort of 4 ounces a week. There's also the environmental aspect. So, we're told to favour plant proteins as well because it's better for the environment as well as being very good for our health. So yes, the advice on red meat is controversial, though to be fair, when you read the detail of these new guidelines, they do mention plant proteins. It's just you don't see that easily in the upside down pyramid they've produced.
Indeed. Well, one thing that does stand out in their visual there as well is the size of the grains. They seem to want us to eat less and less of them. And I'm wondering what the logic is there.
Yes, and that's possibly one of the most controversial subjects, because all the studies generally show that whole grains are good for our health. They're readily available, they're not expensive, they add fibre, which is good for our gut microbiome. So that you could argue that logically there's not really a need to advise people to limit their consumption of grains. Coming back to red meat's also very expensive for a lot of budgets. So getting your protein from beans, lentils, complemented with whole grains makes sense from a budgetary perspective and from an environmental perspective for a lot of people.
And there's also the question of our lifestyle. I mean, as you say, there's the cost and also the way people live, because they have picked up on ultra-processed food. And I feel like that's something across the world people have started to realise are bad for us. Hard, though, to avoid processed food in general. I mean, there's so many bad things things that we're told are bad for us. What's your rule when it comes to food? How do you break it down?
So let's be clear, as soon as you kind of process any food, it becomes processed. It's a degree of processing. So in France, for example, you buy fruit compotes. I mean, they're processed. But it's the degree of processing that's the issue. And it's possibly the addition as well of ingredients that you don't recognise. So the general rule is if you don't recognise easily an ingredient as being a real food per se, that you should try and limit your consumption of ultra processed foods. But something like a ready-made meal that contains, meat, fish, grains, vegetables, that's not necessarily bad for you. It's more things like drinks or sweets that don't really contain any of the original ingredients, so apple flavour rather than any apple, a colour that doesn't really exist in the foods we see in other, foods we see in the market, or sort of normal foods that we see. So it's that kind of ultra processing with ingredients that we don't recognise, that are completely detached from the original food, that should be minimised for our health.
Okay, that makes it clear, and it's good to appreciate the food that we have in so many different forms. But finally, as a nutritionist, I mean, how much do you think people should be told what to eat, and how much is it better for people to go with what their body tells them to eat?
That's a very good question. In my experience, a lot of people do know how they should be eating. So people know they should be eating unprocessed foods, having less sugar. But I think sometimes life gets in the way. I think with busy lives, with long working hours, and maybe someone's limited in terms of their cooking facilities, I think it can be quite hard. So we should possibly be a little bit kinder with our recommendations. It definitely makes sense to add in more fruits and vegetables, but they don't have to be fresh. They can be frozen, they can be canned. It definitely makes sense to limit added sugar, so less cakes, biscuits, replacing it with fruit instead. So I think really it's taking the guidance and trying to make it work for you. And even if it's just one or two things that you change, that's already a very, very big step for your health.
Okay, Charlotte DEBEUGNY, thanks so much for joining us and giving us your insight on it all. Very much appreciated.